We're going to keep going with our cardiovascular unit here, and we're going to focus a little more on EKGs. And we're going to focus specifically on something called an arrhythmia, which is when there's an issue that somebody has with their heart and how the heart beats. And essentially, you're going to find out if somebody has something wrong using an EKG. So let's go through it. So I talked about EKGs in another lecture, and we talked about the fact that when you're looking at an EKG, there are three distinct waves that you can see. There's the P wave, which is going to be the contraction of the atria. There's the QRS complex, which is going to be the contraction of the ventricle. And then there's the T wave, which is the relaxation or repolarization of the ventricle. And remember, the atria also relaxes, but it happens at the same time as the QRS. So that's why you don't see it. It's just that the QRS contraction is so strong that the relaxation of the atria just gets lost in the shuffle. But let's keep going here. So basically, when you look at an EKG, you're not looking at a single wave. It's not, your heart doesn't beat once and then that's it. It beats over and over again. At least ideally, it beats over and over again. So when you look at multiple waves in a row, you can find out about what's going on with the patient based on how their waves look. So if you take a look here, the P to P is going to be really one complete heartbeat. So from one P wave to another P wave, this is considered one heartbeat. And then something called the PQ interval is the time it takes for that impulse to travel from the SA node to the AV node. So that's the time it takes for the atria to contract and push the blood into the ventricle. And that's this distance right here. So the PQ interval is the distance between the P wave and the Q wave. And then QT is just the interval between the Q contraction and the T would be when it relaxes. So just a little, we talked about that before, but that's just a quick review. So what are we measuring here? Well, let's take a look. So one of the first things that we look at when we look at an EKG, and if somebody has a healthy heart, is something called the QT interval. And essentially, that's the time between the ventricle depolarizing or contracting and the end of it repolarizing. And you want that to be a certain amount of time. You don't want it to take too long, because if the ventricle takes too long to contract and relax, that means the body's not getting blood for that time period, right? So if there's a slow contraction of the ventricle, that's going to really delay the blood going into the body, into the systemic blood flow. So a healthy heart should have the QT interval should be about half the length of the distance between the two R waves. So this is the RR interval here between the QRS complexes. So you want a healthy heart to be right about halfway in that distance. Now, if it's longer than that, if it goes past that point, it's called long QT syndrome. And what that means is that your ventricle is essentially contracting and relaxing much slower than it should. So this just shows you the difference between the two. So this would be a normal QT. You got that distance where you're supposed to, and this would be a long QT, where you can see it goes over and it's just a much longer relaxation. And again, that just means that there's a delay in blood flow to the body. Another common issue is something called a bundle branch blockage. And a bundle branch blockage refers to when there's a interruption in the electrical impulse going from the, so we have our SA node going to our AV node, right? That's going to be that PQ interval. And then that impulse travels down the bundle branches and then up the Purkinje fibers. Well, sometimes there's an issue that prevents that impulse from traveling down to the base, to the apex of the heart, I should say, and back up again. And that is called a bundle branch blockage. And you can tell that in the fact that the ventricle, the QRS wave, is much longer. So you have a much wider QRS wave. And normally it should be 0.08 to 0.12 seconds. So, obviously it's a short amount of time. But if it's more than 0.12 seconds, that means something is interrupting the flow of electricity of the impulse down to the apex and back up. And it just slows down your ventricles from being able to contract. Usually not a problem, but if you're an athlete and you have a bundle branch blockage, that can be a problem. So again, this is a rather common condition, unfortunately, and if you have a bundle branch blockage, it just might limit your ability to do strenuous exercise, because that means you're not going to be able to have a strong enough contraction of your ventricles. So that's called a bundle branch blockage. And again, you can tell a bundle branch blockage because now one thing you'll notice here is this EKG is upside down, and that's normal. That just means that the flow is being reversed of the electrical impulse. But you can see here, it's a little bit wider than it normally would be. Let's keep going. Let's talk about some specific arrhythmias, and then I'm going to have you identify some in class. So what is an arrhythmia? Well, normally a heart beats about 60 to 100 times a minute. That's your average. Usually 60 to 80, but up to 100 is considered normal. And each contraction is a heartbeat, right? And if it's an abnormal rate or an abnormal EKG, it's called an arrhythmia. A before anything means not. So it's not in rhythm. That's what arrhythmia means. And there's a bunch of different kinds. Some are completely harmless and some can be deadly. So let's go through them now, and then I'm going to hopefully have you be able to identify them in class. So the first type of rhythmia, now this is not an arrhythmia, is called a sinus rhythm. That is a normal heart rate. So if you take a look here, you can see an easily defined P, Q, R, S, T. They're the right distance apart. They're evenly spaced. This is a healthy, happy heart, and that's called sinus rhythm. So sinus just means normal. That's a normal heart. Now if you take a look here, you'll see down here we have, and over here we have two other examples called bradycardia and tachycardia. Brady means less, lower, tachy means fast. So bradycardia would be when it's a slow heart rate. So if you look here, you can see the P, Q, R, S, and T are much farther apart than they are in this scenario. It's a slower rate. So if it's less than 60 beats a minute, that's considered bradycardia. And then if it's over 100 beats per minute, so you can see here, you can still see the QRS. Here's the P, QRS, and T, but they're much closer together. That would be tachycardia, which means it's over 100 beats per minute. That's not a problem. That's not a problem because your heart goes into tachycardia anytime you exercise. If you go into fight or flight, like if you watch a scary movie or you hear something that scares you, your heart rate's going to go up. So being in tachycardia is not bad unless you're resting. So if you're sitting in your chair and everything's fine and your heart rate is very high, that's called tachycardia, and then that can be an issue. So just a quick review of this slide. We have our bradycardia, which is going to be a slower rhythm. We have tachycardia. Sorry, I keep doing that. And tachycardia is going to be a faster rhythm, and then sinus is normal. Let's take a look at some more examples that get a little more serious. Let me move my head here. Okay, so the next one is called an atrial flutter. And an atrial flutter is when your atria contracts multiple times before the ventricle contracts. Now, again, that's usually not a big deal because your atria, really, when your atria contracts, 80% of the blood just goes from the atria to the ventricle without a contraction. Only about 20% of the blood gets pushed down from the contraction. So even if your atria is not working at all, even if your atria is shut down entirely, your heart will still function because the blood is just through pressure and blood movement, it's going to make its way to the ventricles. But in some instances, you get something called an atrial flutter. So if you take a look here, you can see this would be a normal one, P, Q, R, S, and then T. But then if you take a look at this next heartbeat, you can see there's 2 P waves, and then it gets to the QRS. Here we have 3 P waves. So you can see there's multiple P waves before you have QRS. Now, this heart is okay. This person is going to be okay. Again, they might be limited in their activity, but this is not dangerous. So you're going to have many more P waves than QRS waves, and it's called an atrial flutter. Now, the second type on the slide is called an atrial fibrillation. This is more serious, and you can see this. You can tell it's atrial fibrillation because that means the heart's not really contracting. It's just kind of freaking out. It's to say it in a much not very scientific way, but instead of having a strong contraction, it's just kind of freaking out. It's not a great way to say it, but that's what it's doing. It's not giving you a strong contraction. So you can see here, this would be a normal one, and then here you can see there's no obvious P wave. So the atria is not contracting like it should. This is where somebody might get a pacemaker put in. This means that the SA node is not functioning the way it should. So you're going to get a chaotic and random contraction of the atria. Again, not deadly, but it would be something that you would have to deal with. Okay, a couple more. This next one is called junctional rhythm. And junctional rhythm is pretty serious, but manageable. So how can you tell if it's junctional rhythm? Well, first of all, what is junctional rhythm? Junctional rhythm means that you have no SA node. Your SA node is not functioning, and your heart is being regulated by the AV node, which is a slower contraction. So if I take a look at this junctional rhythm, how can I identify it as junctional? First, there's no P wave at all. So it's not like atrial fibrillation. In atrial fibrillation, there's some activity there because the atria is contracting. It's just not contracting in a rhythm. It's just going crazy. Where in junctional, there's no contraction at all. It's a flat line. So you can see here, there's no P wave. It goes right to the QRS and then to the T. And you can also tell it's junctional because it's much slower. So it's going to be in bradycardia, between 40 to 60 beats per minute. So if you take a look here, these are much farther apart, spaced farther apart, and there's no P wave. So that tells you that the SA node is not working, and this person has their AV node running the show. And again, your heart will work without an SA node, but it's going to be dangerous. So this would be somebody who might get a pacemaker put in because their SA node's not working, so they get basically an artificial SA node, which is going to allow the heart to keep beating. And then the final type, this is the bad one. If you take a look at it, you can see this is the bad one. There's no discernible waves. So this is called ventricular fibrillation. You cannot function without your ventricles contracting. You can function without your atria contracting. You can see it right here, but you can't function without your ventricles. So what happens here, it's a chaotic depolarization of the ventricle. So basically, it's your ventricles freaking out. So when the atria freaks out, it's bad, but not that bad. When your ventricle freaks out, that is really bad. What it means is you're having a heart attack or electric shock. The only way you're going to see this, and if you've ever seen a show before, a hospital show, you might hear someone saying they're going into VFib, get the crash cart, right? The crash cart is going to be your AED machine to try to restart the heart. So if somebody's in ventricular fibrillation, that means that they're dying. And luckily, you can restart it. You can reset that rhythm with an AED machine if you get to the person quick enough. But in this scenario, there's no P wave, there's no QRS, there's no T. It's just a big disaster of a graph here, really. So that's it. Those are the 5 that you need to know or be familiar with, and I'm going to have you practice identifying them in class. Thank you very much.